Hello, awesome students! Do you know what is STD?
STD stands for sexually transmitted diseases. STDs are passed from one person to another. They are passed through sexual activity including vaginal, oral, and anal sex.
There are different types of STDs which include HIV, chlamydia, gonorrhea, genital herpes, syphilis, pelvic inflammatory disease, and many more.
But for today, we are going to focus on the most common type of STD, which is called HIV.
HIV stands for Human Immunodeficiency Virus. It is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases.
If left untreated, HIV can lead to the disease called AIDS, that stands for Acquired Immunodeficiency Syndrome.
1 in 7 living with HIV are unaware of their infection.
Gay, bisexual, and other men having sex with men are the population that is most affected by HIV. Transgender women who have sex with men are among the groups who had the highest risk for getting HIV infection, and injection drug users remains at significant risk for getting HIV.
Other individuals who can be infected by HIV are pregnant women, infants by inheriting the disease from their mother, and people with age 50 years and older.
But how is HIV spread from person to person? You can get HIV from coming into direct contact with certain body fluids from a person with HIV and with a detectable viral load. These fluids are blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk.
HIV can only be spread through specific activities.
The most common ways are having vaginal and anal sex with someone who has HIV without using a condom, or taking medicines to prevent or treat HIV. Now remember, anal sex are riskier than vaginal sex, and so is sharing injection drug equipment such as needles with someone who has HIV.
When you live in a community where there are many people who are infected with HIV, there is a higher chance of being exposed to HIV when you have sex, when you share needle or other injection equipment with someone who have HIV. HIV can look different in each person because not everyone have the same set of symptoms, and some people may have not experienced any sign for a long time.
Within 4 weeks when you become infected, the early HIV symptoms includes fever, headache, fatigue, sore throat, skin rash, swollen lymph glands, diarrhea, and more.
AIDS is the last stage of HIV. The different signs of AIDS include extreme fatigue, fast weight loss, diarrhea that lasts for more than a week, pneumonia, fever or severe night sweats that keep coming back, memory loss, and more.
Anyone can get HIV, but you can take a step to protect yourself.
First, get tested with your partner with HIV before having sex. Second, choose less risky sexual behaviors. Third, use condoms every time you have sex. Fourth, limit your number of sexual partners. Fifth, talk to your healthcare provider about pre-exposure prophylaxis to reduce the risk of getting HIV. And lastly, use only sterile drug injection equipments and never share your equipment with others. In conclusion, STDs such as HIV is a topic that we should normalize teaching. That is why through this, we encourage you to be aware, educated, and empowered in order to fight the growing problem of STD. Together, we fight and stop STD.